Are naturopathic doctors witch doctors? So as a naturopathic doctor, we have quite a lot of testing, quite a lot of education. It is at least a 4-year graduate program. You can see right here at the top that we do have a significant amount of units of basic sciences as part of that 4-year degree. Here is a handy chart comparing the number of units that we have for these basic sciences compared to allopathic medical doctors according to the ANMC. In addition to our training, we have a significant number, I think it's 1,000 clinical hours, as well as clinical boards and continuing education credits. This is for licensed naturopathic doctors. That's different than naturopaths in many states. It's a little bit of an unregulated term. In some states, people that are calling themselves naturopaths have an online training or a certification course that is not nearly as rigorous. They also do not have the full scope of rights and privileges that licensed naturopathic doctors have, especially here in California or in Washington, where I completed my training. But I realize this does not answer my initial question of are we witch doctors? I mean, that depends on how you define people who use herbal medicine. I will sometimes jokingly refer to myself as a bit of a witch doctor because I do custom herbal formulations based on research, and the latest studies. There are studies on herbal medicine, quite a lot of studies. In fact, many of them were used to make medications. That's where a lot of medications come from, actually, is herbal herbs, herbal medicine. Now, this is not the only modality that I use, or even often the primary modality that I personally use, but as naturopathic doctors, we have quite a bit more training in things like nutrition, in counseling. We also have quite a bit of training in the evidence-based use of minerals, vitamins, amino acids, things like that. I do tend to use a fair bit of herbal medicine. I do custom blends of herbal mixtures for my patients for a variety of different ailments. We also do use and can use different pharmaceuticals, and that's a little bit state by state. Here in California, I do have full prescribing rights under the supervision of a medical doctor. I do have a relationship with a medical doctor that does allow me to write different prescriptions, although it's not my primary modality, but I will use those medications when necessary because, sometimes that is the best medicine for a patient. It's often very surprising for patients to hear me say that, naturopathic medicine